Hello! Today we will see somewhat beyond the borders of microwave testing in the narrower sense. We will see the similarity to non-invasive medical diagnostics. Some women tend to hesitate with regular breast screening. They fear the X-rays and their potential harmfulness. Now, microwave-based breast screening has been developed, and this is harmless. The reason for this is that microwaves, in opposite to X-rays, are non-ionizing. We rely on microwaves daily by using our mobile phones. In the following, we will see a short video about microwave-based mammography. After that, I will give you a link to a video which shows this in more details. So, let's start.
Breast cancer is the most common cancer in women worldwide. To reduce its mortality rate, it is fundamental early breast cancer detection. Thus, it is fundamental to perform regular screening. Currently, due to the concerns related to ionizing radiation, only less than 20% of women are eligible for screening. In this context, mammography can play a fundamental role since it can be used for women in any age, in any physical condition, and as frequently as required. The mammograph device consists of a cup that holds the breast of the patient when she lies on the examination table. There are two antennas which rotates around the breast, transmitting and receiving the scattered field from the breast. Mammograph is based on a novel imaging algorithm that processes the microwave signal, allowing the detection of any breast lesion inside the breast. In addition, in contrast to conventional mammogram, mammograph is more comfortable for patients since it requires any breast compression. Ongoing clinical trials show an excellent sensitivity of mammograph, which holds also for dense breasts.
Both sensitivity and specificity have been augmented, equipping mammograph with artificial intelligence. Mammograph can be used in all the symptomatic population without any safety restrictions such as age and frequency of use, for allowing distinction between breasts with and without lesions. Our company, with a subsidiary in London, grew alongside Mammograph. Thanks also to Horizon 2020 grants, we successfully turned our idea into a clinically validated device, patented, CE marked and ready for the market.
If you want to learn more about microwave-based mammography, you should open this link and the video which is embedded there. So that's it for today. See you next time. Thank you for watching. Goodbye.